Hello there, it's Dr. Lippy Roy, and welcome to my show, Health, Humor, and Harmony. There's something in the air today, maybe you've noticed. Today is April 20th, or 420, also known as Weed Day, a day that has become an international holiday where people worldwide celebrate and consume cannabis. So I'll talk about marijuana both from a health and policy standpoint. Next week, April 24th to the 30th, is also National Infertility Awareness Week. This is an important health issue, women's health issue, which I will discuss considerably in future episodes. But today, I'll focus on the connection between marijuana use and infertility. But first, 420 or Weed Day. Marijuana, also referred to as cannabis, weed, pot, or dope, refers to the cannabis plant, which contains over 100 compounds or cannabinoids. The main active ingredient in marijuana is THC, or tetrahydrocannabinol, which can be mind altering. The second most common active ingredient is CBD, or cannabidiol, which does not cause dependence, addiction, or a high. In fact, CBD is an essential component of medical marijuana, which I will discuss shortly. So, what are the health impacts of cannabis? Let's start with the bad news. Marijuana can impair brain function, including thinking, memory, attention, and coordination. When used before age 18, marijuana can impair brain development and impair learning at school. The earlier and more frequently one uses, the greater the chance of developing a marijuana use disorder or addiction. In addition to the brain, marijuana can also damage our heart and lungs. Marijuana, however, also has many health benefits. According to Dr. Peter Grinspoon, a Harvard doctor and cannabis specialist, the most common use for medical marijuana in the United States is for pain control, particularly chronic pain, which plagues millions of Americans every year. Marijuana is safer than opioids since marijuana is far less addictive and almost impossible to overdose on. And it's not associated with kidney and GI problems the way NSAIDs like ibuprofen, Aleve, or Advil are. Dronabinol or Marinol is synthetic THC and is FDA approved for the treatment of nausea and vomiting caused by cancer chemotherapy. And it's used to treat loss of appetite and weight loss in people with HIV and AIDS. A promising area of research is in treating PTSD, or post traumatic stress disorder, among veterans returning from combat zones. Marijuana, unfortunately, has a very complicated, politicized, and racialized history, particularly here in the United States. Despite its many health benefits, cannabis remains a Schedule I drug under the Controlled Substance Act as determined by the Drug Enforcement Agency, or the DEA. According to the Deep Drug Policy Alliance, or DPA, every 90 seconds, on average, someone in the US is arrested for a marijuana offense. Unfortunately, Black people are arrested at disproportionately higher rates than their white counterparts, despite similar rates of use. A 2020 report from the ACLU showed that Black Americans are 4 times more likely to be arrested for cannabis possession or use versus white Americans. This is a big deal in light of the large number of arrests that occurred generally. Between 2018 and 2019, FBI data showed that more than 1.2 million cannabis-related arrests occurred in the United States. This so-called war on drugs, which is really a war on people, and specifically on people of color, has been deemed a colossal failure by the Global Commission on Drug Policy. Thankfully, in states where cannabis has been legalized, cannabis-related arrests have significantly dropped. Yet, racial disparities in arrests still occur. As of January 2022, 18 states in the United States have legalized recreational use of marijuana. According to the DPA, the United States government will spend approximately $47 billion every year enforcing drug prohibition. So let's now shift gears. As I mentioned earlier, next week is National Infertility Awareness Week. So, first off, what's the actual definition of infertility? According to the American Society of Reproductive Medicine, infertility is a condition characterized by the inability to conceive after 12 months of unprotected sex or intercourse. For women aged 35 and older, inability to conceive after 6 months is generally considered infertility. It affects 10 to 15% of couples, making it one of the most common diseases among people aged 20 to 45. There are many risk factors for infertility, a large one being age. Fertility declines as we get older. Healthy women in their 20s to early 30s have a 25 to 30% chance of conceiving. At age 40 and above, the chances drop to 10% or less. Ovulation problems can also affect fertility. PCOS, or polycystic ovarian syndrome, thyroid disease, obesity, and irregular menses can all affect ovulation. Sexually transmitted illnesses, 1/4 of which are acquired by teenagers, can lead to pelvic inflammatory disease, or PID, in women and epididymitis in men. One of the complications of STDs is infertility. Endometriosis has also been associated with infertility. 1/3 of infertility cases are related to male problems. Risk factors include sperm quality and release or ejaculation, chronic health issues such as diabetes, cystic fibrosis, and overweight or obesity, as well as alcohol, cigarette, and marijuana use are all risk factors. Now, speaking of marijuana, and this is where I want to connect 420 and marijuana use with infertility. A study from the National Institutes of Health, or NIH, suggests that women who use marijuana have more difficulty conceiving than women who do not consume weed. This study looked at a small number of cannabis users, 62, so the researchers did caution that more research is needed. Animal studies have found that cannabis use can alter the lining of the uterus, making embryo implantation and pregnancy more difficult. Other research findings have shown that marijuana can lower testosterone and estrogen levels in women. Marijuana affects male fertility too. First, marijuana lowers testosterone level in males. But in addition, researchers at Tulane University and the University of Washington found a connection between low semen volume and damaged sperm among men who smoked marijuana. According to Dr. Omer Rahim, lead author of the study and assistant professor of urology at Tulane University School of Medicine, my alma mater, quote, "This is one of the first studies that show a decline in sperm quality in current and past male marijuana smokers compared to non-smokers, adding to the evolving evidence of marijuana's potential negative impacts on human reproduction." Well, folks, that's all for today. I will definitely be talking far more about both marijuana and women's reproductive health in future episodes. But here is your joke for today, weed style. What do you call a family that grows marijuana in their backyard? A joint family. uh, Tune in this Friday, 3 p.m. Eastern, when I'll be discussing Move More Month and Earth Day. Be sure to subscribe to my YouTube show and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.